Hi everybody, I'm Dr. Bill Sterett. We're going to take this up a little bit right now. People have come in, have torn their ACL playing football, playing basketball, skiing in my world. They go through, okay, what happens if I don't have surgery? What happens if I do have surgery? Well, what's the next step? If I do have surgery, what are the chances I'm going to get back playing the sports I want to do? And what are my risks of re-injuring it? So this minute, I'm just going to talk to you about the odds of you tearing your ACL a second time, unfortunately. So hopefully you never have to watch this video too hard, but if you do, these are the reasons. So in a long-term study, the French alpine ski team, more than 20% had torn their ACL a second time, and another 10% on the opposite knee. So over 30% had had a second ACL injury of the French alpine ski team. So ski racing in general, especially once you've torn your ACL, you're at risk for tearing it again. For just our standard recreational or high-profile athlete that or high-level athlete that has torn their ACL, we talk about ACL reconstruction being about 95, even up to 98% successful in terms of not tearing again. But that still leaves about 5% chance that you're going to tear that again. In reality, we have to look at it versus the other knee, and it's almost a little bit higher. It's up to about 6% risk that you'll tear the ACL on the other knee. So it gets you back about equal to the other knee in terms of risk of re-injuring your ACL. Having said that, now look back on some of the other things we've talked about. What are the issues that might predispose you to have that French alpine team or higher risk profile? It has to do with the sports you like. It has to do with some of your factors. Do you have weak gluteal muscles and you get that dynamic valgus that puts you at risk? Do you land straight-legged? Are you doing things that where your strength isn't good enough, your endurance isn't good enough, or your trust isn't good enough that puts your knee at risk again? So overall, reconstructing your ACL may just put you at the same risk as tearing the other knee. If you have some of those other factors, you're loose jointed, you don't have the strength, endurance, or trust to get back, then you need to take that into account about what you want to do or just understand the risk. I'm Dr. Bill Sterett with your Sports Medicine Minute. Thanks.